Lumobo na sa mahigit 16,000 ang mga kaso ng monkeypox sa buong mundo mula noong Mayo. Dito sa Pilipinas, wala namang naitalang kaso pero patuloy ang paghahanda ng health officials. Paano ba maiiwasan ang sakit na ito? Tatalakayin natin yan sa Serbisyo Ngayon, kasama ang infectious diseases experts na si Rontgene Solante. At pwede rin po kayong sumali sa ating talakayan, i-post ang inyong mga tanong o komento sa aming Facebook Live. Magandang hapon po, Doc.
Hi, good afternoon, Ruth.
Doc, unahin ko lang kasi over the weekend, dineklara na public health emergency of international concern ang monkeypox outbreak ng WHO. Ano po ba ang ibig sabihin niyan?
That only means that there's a possibility that monkeypox will spread to more countries, no? Aside from the 75 countries that has been documented to have this infection. No? So making countries ready and prepare a structured response, no, and coordinated response to how to handle monkeypox and stop human-to-human transmission.
Pero hindi po ba, kasi syempre yung iba parang nagulat or natakot, di ba? Parang international concern or baka mamaya bagong, parang ganyan po nagsimula ba ang COVID-19 noon?
Yes, it also started that way, no? And that's why, Ruth, no, I think it's more of a preemptive declaration by the WHO, so that for those countries na wala pang monkeypox can really strengthen their preparation and how to handle this monkeypox, no? Like informing, raising awareness, ano ba itong monkeypox, ano ba ang mga clinical manifestations, at sino ba yung mga high risk dito na makakuha ng ganitong infection, how we can prevent the transmission from one human to the other. So these are all in place and hopefully can be fully implemented also by the Department of Health.
Binanggit nyo na rin, raising awareness. Ano po ba itong monkeypox? Ano ang dapat naming tandaan tungkol sa sakit na ito?
Well, ito ay isang sakit na usually nag-uumpisa ng mga skin lesions, no? And ito yung nakikita natin ngayon sa mga ibang bansa na hindi endemic for monkeypox, no? Kasama dito yung mga skin lesions sa mukha, sa bibig, at meron din sa genital part, no? Kasama dito yung lagnat, masakit ang ulo, and then most of the time yung mga skin lesions are very prominent among those who had monkeypox. Okay? Ang medyo ano lang dito ngayon, Ruth, no, in most non-endemic countries, ang most common mode of transmission is sexual transmission, no? And has been documented among those with multiple contacts. So kailangan din natin i-raise ang awareness sa mga ganitong klaseng mode of transmission.
Dati na po ba itong sakit na ito? Kasi meron tayong mga smallpox, chickenpox. Parang ba't ngayon lang po natin siya narinig?
Yes, matagal na tong sakit na to, ano? In fact, it was I think in 1970 nag-umpisa to. And it started in the West and Central Africa. And ito kasing mga bansa na to, merong tinatawag na mga carriers of the microorganism, no? Itong mga monkeys, okay, mga squirrels that they also use for hunting. They eat this food. And kadalasan nito, ma-contaminate ang tao by eating and handling these infected animals. No? So it has sporadic cases in this part of the globe, but there are already countries before na nag-report din ng ganitong mga monkeypox because they are also bringing these animals to their countries or has been exposed, and then while incubating, they are back in their country and then having the symptoms and also transmitting to other humans.
So parang ang nangyayari, Doc, ata, no, parang nakalabas na kasi siya doon sa bansa na endemic doon dati. Parang ngayon mas marami nang affected. May binanggit na rin po kayo kanina ng mga ways kung paano nahahawa. Paki-explain lang po ito, bakit din nakarating sa ibang bansa. Yung sinabi niyo yung mga hayop, yung sinabi niyo yung pakikipagtalik. Ano po pong ibang paraan para ba yung dati, yung, di ba yung maduduming sheets, di ba pag bulutong tubig, yung mga ganon?
Well, yung mga nakikita ngayon sa mga non-endemic countries like US and Europe, these are mostly men, no, na nakipagtalik and then carrying the virus and then transmitting it to another man. So more of ang pinaka-common ngayon na mode of transmission sa non-endemic countries is sexual transmission, no? And they are still looking at kung how did this virus came into these countries, because there are a lot of reports that there are those who did not have travel in this West and Central Africa, no? So hindi naman trace, which is also very difficult to trace. So siguro we have to raise that awareness na some of these individuals are also seeing yung tinatawag natin ng mga sexually transmitted clinics, no, in those countries, because ang itsura ng mga skin lesions nito initially can also be misinterpreted as a sexually transmitted infection.
Sige po, mamaya marami pa tayong pag-uusapan tungkol dito sa monkeypox, pati yung sinasabi na meron naman daw po kasing dito, no, vaccine para dito. Kasama pa rin natin si Dr. Rontgene Solante sa pagbabalik ng Newsroom Ngayon dito sa CNN Philippines. At kasama pa rin natin sa serbisyo ngayon si Dr. Rontgene Solante. Pinag-uusapan po natin itong monkeypox. Doc, kanina binanggit nyo, no, yung manifestation pwedeng skin lesions. How do you differentiate it from the regular na halimbawa acne or regular na skin rashes?
Well, itong mga skin lesions niya are usually localized, no, doon sa mga bagong kaso nakikita, no? Sa mukha, sa bibig, no, merong mucosal, no? Yung acne naman talagang wala yan sa mga mucosal. Hindi yan sa lips or sa mouth, no? And at times, meron ding dito sa mga genital organs, no? And it can be postular, may mga nana, may too big, okay? And at most, it can also be just like parang acne na medyo malaki ang size niya, no? So it's important na palawagin natin yung awareness nito in terms of really educating mga healthcare workers, mga doctors and nurses to really look at the skin lesions, yung pattern ng distribution, at the same time yung progression, because dito natin makikita na mas maiba tong lesions nito kumpara doon sa mga ordinary skin lesions.
Dr. Solante, may mga tanong po dito sa yung netizens natin kung meron bang cure or meron bang bakuna para dyan, at meron ba tayo dito sa Pilipinas kung sakali?
Okay. Most of the cases that are documented now are usually is self-limited. Ibig sabihin, just have to isolate them and monitor their hydration, including pain, no? So hindi siya ganun kataas ang mortality, no? Hindi kagaya ng COVID, no? But in a way, wala pa tong talagang gamot na talagang for this monkeypox. May mga antivirals na ginagamit ngayon sa ibang bansa, but these are on limited data and availability. Okay? Then in terms naman sa bakuna, may mga bakuna nang ginagamit ngayon sa ibang bansa na binibigay lang muna targeted towards the mga healthcare workers na who will be the possible target, or what we call a risk population, who will be caring for these patients with monkeypox. So hindi din ganun pakalawak ang paggamit ng bakuna dahil iba ang platform na ginagamit nitong bakuna na to.
And then may particular parang vulnerable ba na mga tao na pwedeng magkaroon nito ng monkeypox?
Well, everyone is vulnerable, especially if you are in contact, no, with a patient or an individual already diagnosed, especially pag lumalabas na itong mga skin lesions, no? And the most common mode of transmission, yung nakikita dito sa Central and West Africa, is also the droplet, no? So makipag-usap ka lang within 3 feet. Tapos pag nahawakan mo yung mga skin lesions, no, without washing your hand, and you have an open wound, pwede mo ring makuha ang mga infection na to. Or yung mga ginagamit nung pasyente, yung mga kumot or mga unan na contaminated with the wound, then pwede rin ma-contaminate kung hindi tayo maghugas ng kamay. Kaya napaka-importante ang health protocol to minimize the transmission of this.
Siguro huli na lang, Doc, ano po ba ang bilin nyo para maiwasan ito at para lang mapakampante rin ang publiko? Ano bang ginagawa ng DOH para hindi makapasok sa bansa itong monkeypox?
So far, meron ng mga ginagawa ang Department of Health, no, in coordination with other agencies and in terms of implementing specific way of reporting, no. So isa dyan is making healthcare facilities be ready in the event na meron ng mga kaso or isolation, and at the same time coordination with mga referral laboratories for diagnostics. Like there are 2 diagnostic centers where you can refer their patients highly suspect of monkeypox. These are RITM and the Philippine Genome Center.
Siguro pahabol na lang, Doc, kasi may tanong dito sa Facebook natin si Rica. Ano daw difference niya sa bulutong? Kanina may na-mention kasi kayo na may certain areas talaga na makikita yung lesions dito, no?
Yes, sometimes it can appear as parang bulutong, no, because of the vesicular nature of the lesions in some of the cases. So it's also very difficult to differentiate this, no. But ang kaibahan lang nito is bulutong is usually all over the body, no. But this one is mostly localized in some parts of the body.
Okay, maraming po salamat kay Infectious Diseases Expert Dr. Rontgene Solante.